An emergency room doctor in New Jersey has become the first doctor to die in the United States from coronavirus. Dr. Frank Gabrin died about a week after developing symptoms. His friend Debra Vaselech Lyons joins us now from Florida. Good morning to you, and firstly, my condolences on the loss of your friend.
Thank you, Kristen.
We've heard a lot in Australia about how New York is the new epicentre of the global pandemic. What is your understanding of what the situation has been in New Jersey?
Frank worked in a hospital in New Jersey, and he also worked in a hospital in Queens. He floated around emergency rooms. What we had been paying attention to what was going on since it started and keeping in touch and seeing what it was looking like. And in the beginning, it was fairly manageable. And about 2 weeks ago, he started seeing a huge uptick that was happening. And then he started becoming not concerned that they would handle it. Every emergency room doctor and nurse, they've trained for these type of things, but just that so many people would be coming in. He was concerned that just for the people that would be getting sick. He did not expect to be getting sick himself.
Can you tell us, did the hospitals that Frank worked in have enough PPE gear? We continue to hear about the shortages of these supplies worldwide.
Well, in the weeks leading up to it, I think everything was good in a normal situation. Most of the hospitals in New York, when the emergency rooms are already pretty stressed out. And from my understanding from Frank, he hadn't complained about any lack of supplies until the week of the March 15th, when at the end of that week, he had run into a situation that the uptake had gone up so fast that he didn't have enough supplies during the day. They were running out. That was the week that he had to reuse a mask. He was given a kit at one hospital. He worked multiple shifts in that hospital and another, and there was no masks to replace them as they're supposed to do all of the time. And he said that just because it became so quick, so fast, he was telling me on the day that he was worried about the supplies that they had, is that, at the hand washing stations, they're so busy they were running out of soap. That the gloves that they had, they'd run out of extra larges, so the mediums, every time he'd put them on, they would tear. But the biggest concern he had was that he didn't have but one mask, and that mask he was having to clean, and he knew that that was going to make it ineffective.
And so did he continue to go to work under those conditions?
I don't think that was ever a question for him. He never even discussed it. That whole week he did go to work. I talked to him at the end of that week and asked him how it went. And actually, he had called me that morning and asked me to help him out. He wanted to source some aloe vera gel and try to see if we could find some hand sanitizer because he had run out. I was running out at home, and he just wanted to make sure he had it to bring with him to work. He was hoping we might be able to find some masks. It was his first day off, so he was working to find supplies. And so, immediately we sourced gloves. My husband's a woodworker, so we were able to get nitrile gloves that they also use for woodworking. And then we were able to find hand sanitizer, but it was going to take a week to get there. The best he could do that day, his husband found aloe vera plants and they brought it home. They made gel, and Frank got some 151 and they made some homemade sanitizer. He had a few days off from that, so he was off Friday, Saturday, Sunday, and I believe Monday as well. And when I talked to him on those days, he was feeling pretty good by Sunday because he had found out that they were going to get him some masks through work. But he had already gone 4 shifts without masks the previous week. The following Friday, when I contacted him, he was already sick. He had woken up that morning with symptoms. Both him and his husband, and they spoke to the hospital and they'd asked him to stay home to self-quarantine.
Did other doctors and other medical staff working in the same emergency rooms as Frank also fall ill?
Not that I honestly don't know. Frank he worked nights, which is a different shift. So I don't know what has happened to the other doctors, but what is strange about Frank is that he got the symptoms. When I talked to him on Friday, he directly felt it had to do with the mask. And, he he wrote to me. He said, I can count the days back. It goes back to those 4 shifts, and my symptoms came exactly 9 to 10 days from then.
What was the nature of the progression of his illness?
Well, he actually was pretty upbeat about it when he told me he had it. Both him and his partner had it. He felt they got a mild form of it. He really didn't believe it had yet hit the strongest it was going to hit in New York. He had fever, aches, chills, all the classic symptoms without any respiratory issues. I, of course, panicked and said, oh, you guys got to do this. He said, no, we've got this. We're going to go. And we talked about staying up and moving. And also because they would be alone in New York, we made a deal that we would connect once a day to make sure that he was okay. And I apologize for my dog.
That's okay. It's a sign of the times. We get to see a lot of pets at the moment.
I know. And he's not the best quiet voice. But we were, the thing was we were talking every day, and he didn't expect this. He didn't have the symptoms. And that was Friday. We talked Saturday, was okay. Sunday, same. Monday, he actually told me on Monday, Sunday, he told me it's the same. Like he didn't really feel that much different. And on Monday, I spoke to his husband because he was sleeping, and Angel was feeling more aches and pains and all of that. And Frank was sleeping, but they still felt like they were okay. And then Tuesday morning at 10:30 in the morning, Angel, his husband, called me and told me Frank couldn't breathe, and that he was wanting to take himself to the hospital. And Angel was very worried about it. And we both knew that he had to call 911. He hung up with me, called 911, and then called back. We were on speakerphone talking to Frank because he was the doctor. We're saying, Frank, you have to move around. We got to keep you going while they're on their way. And what do we have to do? And his breathing kept getting more and more labored and more and more labored. And it took a while for the EMTs to get there. And by the time they got there, his breathing was almost non-existent. They arrived and they immediately started CPR and tried for almost an hour. Some doctors arrived in midway. I was on speakerphone, so I don't know exactly what happened. I could only hear them doing CPR and talking about the injections and stuff. But Angel told me they did everything, and finally they just had to pronounce him. And it was literally less than 2 hours from the first phone call.
It just must be so distressing for indeed his husband, who I know is still suffering with this same illness, and for you, his friends, the medical community. Can you just briefly give me a sense of whether you think that America is in any way starting to get on top of the response to this illness?
I think that I'm not sure exactly what's going on. I'm not privy to all of that. I do know that Frank, his career as an emergency room doctor, he also worked to help doctors. They were already stressed out in emergency rooms. Emergency room doctors and emergency room health care workers were already stressed in the system, and he was concerned what was coming, and he wanted to make sure that everybody could handle it. He was worried about their mental health more than their physical health, to be honest. I don't think he ever really thought that the protective gear was going to be an issue until it was. So I believe everybody knows how serious it is, but there's still a need. And I've been getting a lot of comments and contacts of people saying, thank you for speaking out. We really need this. And hearing stories of people that still don't have what they need, not only in New York, but around the country. And so my mission is to make sure that everybody knows. I mean, Angel, his husband, Arnold, and I talked about this, and we wanted to make sure that no family needs to suffer, because these are professionals. They know what to do with their equipment. They know how to take care of themselves, and they prepared for an emergency.
Debra Vaselech Lyons, thank you very much for speaking to us this morning.